Lower back pain is one of the major forms of musculoskeletal degeneration here in the U.S., affecting nearly 80% of adults. After watching this video, you'll be provided with some basic tools to help you to reduce or even eliminate lower back pain. We're going to start out with the self-myofascial release for the piriformis. So first, you're going to sit on the foam roller. You're going to cross one leg over the other. You're going to roll slightly toward the side of the leg that's up, and then you're going to slowly begin to roll that area. And you're only going to roll about 1 inch per second. Do your best to relax as much as possible. And you're going to continue doing this for 30 seconds. The next area that we're going to focus on is the quadriceps. For this particular exercise, you're going to lie in a prone position over the foam roller, and you're going to begin to roll from the hip to just above the knees. Remember to keep your quadricep muscles as relaxed as possible in order to feel the effects of the foam roll. If you need more pressure, then you're going to cross one leg over the other and continue to roll slowly 1 inch per second. The next area that we're going to focus on is the TFL and IT band, which is located on the lateral side of the leg. We're going to have you lie in a side-lying position on the foam roller with your elbow down on the floor. Go ahead and cross your top leg over your bottom leg so that you can gain as much control as possible. Okay, you're going to begin rolling from the top of the hip slowly all the way down to just above the knees. And what we're looking for here are the trigger points. If you notice any area where you feel soreness or tightness, take a little bit more time on those areas. The next area that we're going to focus on are the adductors. The adductors are located on the inner thigh area. So you're going to position yourself over the foam roller in a prone position or face down. You're going to prop one leg over the foam roller. You're going to slowly begin rolling from the knee to the hip. To increase the pressure on this area, straighten your leg out and continue rolling slowly from the top of the knee to the hip. Now we're going to move on to the lengthening phase. The first stretch is going to be the kneeling hip flexor stretch. You're going to take one step forward and place one knee down on the floor. The first important cue here is to tighten the abdominals to reduce the lumbar curve. You're going to slowly shift your weight forward until you feel the stretch in the front of the hip. Hold this stretch for 20 to 30 seconds. The next stretch is going to be the kneeling adductor stretch. You're going to place one foot out to the side and one knee down on the floor. Place one hand in the hip so that you can control the stretch. Slightly shift your hips back until you begin to feel the stretch in the inner thigh. Make sure you keep your chest up and your shoulders down and back. The next stretch in our series is going to be the seated hamstring stretch. Go ahead and take a seat down on the floor and straighten both legs out. Go ahead and widen your feet apart and sit up as tall as you possibly can. You're going to place your hands on one thigh and slowly reach down toward your ankle until you feel the stretch. Hold this stretch for 20 to 30 seconds. For additional back support, you'll do this exercise up against the wall. The next stretch in our series is the supine piriformis stretch. For this exercise, you're going to lie flat on the floor with your face up. Go ahead and straighten your right leg just a tad. Cross your left ankle over your right knee. At this point, you can go ahead and bend your right knee until you begin to feel the stretch behind the left hip. To increase this stretch, go ahead and pull the knee in even closer to your abdominals If you can grab the back of the knee, then proceed to do so. Now we're going to move into our activation series for isolated strengthening. The first exercise is going to be the sideline gluteus medius. So basically with this exercise, you're going to place your top leg straight. Your bottom leg should be bent. Be sure that your top leg is as straight as possible and is in alignment with the rest of your body. So you're going to move your foot back slightly. Good. You're going to slowly raise your leg up. You're going to pause and slowly lower down. Repeat this exercise 10 to 15 times with a slow tempo. The next isolated strengthening exercise is a quadruped opposite arm and leg raise. For this exercise, be sure to keep your lower back in a neutral position. Slowly raise your right arm and left leg. Pause and slowly lower down. Repeat this exercise 10 to 15 times. The next exercise is a stability ball bridge. You're going to lie supine on the floor and place your feet on the stability ball. Apply pressure to raise your hips from the floor slowly until you get to a neutral position. Squeeze your glutes and then slowly lower down to the floor. Repeat this exercise for 10 to 15 reps. The next exercise in our activation series is a front plank. For this exercise, you're going to go down to the floor, knees down, and then rest your elbows down as well. Be sure that your lower back is in a neutral position. If necessary, tuck your tailbone under until you feel the activation in the core. To advance this exercise, put your toes down on the floor, bring your knees off of the floor, and hold in the same position. Continue to hold for 30 seconds to 1 minute. Now we're going to move on to the integrated dynamic movement phase. The first exercise is the swimmer. So lie face down on the floor and place your hands out to the side with your elbows bent. Lift your arms away from the floor and squeeze your shoulder blades down and back. Remember to keep your head in a neutral position, keeping your eyes down facing the floor. Reach forward as far as you can, and then bend the elbows to squeeze again, retracting the shoulder blades. Repeat this exercise 10 to 15 times at a slow pace. The next exercise is the lateral tube walking exercise. For this exercise, you're going to need a resistance band. Take the resistance band and tie it around your ankles. Make sure it's not too tight so that you can have some play while doing the exercise. The next step is to bend your knees and bend your hips and get into the athletic position. And slowly take lateral steps. Remember to keep your knees and hips bent with this exercise. The focus of this exercise is to help strengthen the glutes. Repeat this exercise 10 to 15 times on each side. The next exercise in our integrated dynamic movement series is the front lunge with trunk rotation. With this exercise, you're going to take one step to perform an anterior lunge, bend both knees, and rotate toward your front leg. And then you're going to step out of it and repeat 5 to 10 times on each side.